Lots of recent news is focused on work requirements for Medicaid. Trump administration sure seems open to them. They seem more than willing to allow states to apply restrictions on able-bodied adults who might apply for the program. Let's chat about that. This is Healthcare Triage News. As is often the case, the language around these types of requirements sounds reasonable. If there's no reason for an able-bodied adult not to work, then it's possible that setting some requirements might nudge some of them to improve their lives. Given the high cost of programs like Medicaid, it also seems reasonable to make cuts on those people who are the most able to make do without it. But how many able-bodied adults are on Medicaid? A Kaiser Family Foundation analysis from spring of 2017 found that almost 80% of adults in Medicaid are from working families. Almost 60% are working themselves, and this is without any work requirements at all. Of those who don't work, about 35% are unable to because of disability or illness. Another 28% are taking care of other members of their families in lieu of jobs. Of those that remain, 18% are students, 8% are looking for work but can't find it, and 8% are retired. That leaves about 3% of the non-working adult Medicaid population who we could possibly define as able-bodied yet choosing not to work. A more recent study published in JAMA Internal Medicine in December 2017 focused on Michigan and surveyed more than 4,000 people already enrolled in Medicaid for at least a year. About half of respondents reported that they were employed in some way. Another 4.5% were stay-at-home moms or dads. 5.2% were students, and 2.5% were retired. More than 11% were unable to work. That left about 28% who were out of work. Out of work adults were more likely to be older, age 51 to 64 years. More likely to be in fair or poor health, have a chronic mental health condition, or a physical or mental functional limitation. The true number of healthy, able-bodied adults who could work but choose not to is small. Given that, it's worth considering the cost to administer programs such as these. They aren't cheap, nor are they easy. Forcing those who have jobs to prove that they are employed adds an extra layer of administrative burden that could cause eligible people to lose their coverage if they don't comply with more regulations. Confirming that unemployed adults meet qualifications for not working, perhaps due to disability or illness, will require states to invest in compliance personnel and procedures that will raise the cost of the program itself. They will further need to follow beneficiaries who are trying to find work but unable to land a job. That won't be straightforward either. So what evidence do we have about how this might play out? The closest analogy might be our experience in placing work requirements onto the Temporary Assistance for Needy Families TANF program, which involves federal block grant funds for states to help low-income parents and children. As with Medicaid, people receiving TANF largely worked even without work requirements. Those who didn't work often couldn't. The new requirements didn't lead to significant increases in employment or reduced poverty. They also cost a lot to implement. Look, here's what we don't know. We don't know if creating new work requirements will yield large savings. We don't know how many deserving beneficiaries might be kicked off of Medicaid by mistake. We don't know how much it will cost to implement these programs, and it's possible that it costs more than they save. We don't even know if this policy will incentivize more able-bodied beneficiaries to work, which is the whole point in the first place. Given that, I don't know why so many states are eager to rush to implement work requirements for Medicaid recipients. But we're doing it. We love to make videos about things that sometimes YouTube doesn't like to sell to advertisers. And we're fine with that because what we do is more important than the money we might make. That said, any support you can give us to help keep the show going helps to make it bigger and better. And one good way to do that is through a subscription service called patreon.com. You can go to patreon.com/healthcaretriage and give as little as $1 a month to help the show keep going. If you don't, that's fine. We're going to keep on making it anyway. We'd also appreciate if you subscribe to the show and maybe like the video if you liked it. That'd be great too. We'd especially like to thank our Surgeon Admiral Sam and our research associates Joe Sevitz and Carlos Hiergo. We also have some great merch you might like. We have mugs and posters and lunch boxes and other stuff, and you can check it all out at hctmerch.com. I also have my book. It's still available anywhere books are sold, the Bad Food Bible. I'd really appreciate it if you pick up a copy.